Hi friends, this is Dr. Michelle logging from Strength Within Physical Therapy and Wellness. I wanted to put together a video where I talk through the different diagnoses, the different eating disorder diagnoses. I know I have put out a couple other videos that talk about the benefits of physical therapy during eating disorder recovery, but I think it's really important to kind of understand what the different eating disorder diagnoses are. One of the things to remember related to eating disorders is that they are mental health diagnoses with physical manifestations. So I believe I might have said that when I did the video talking about physical therapy. Yet I do think it's important to keep it in mind as we're talking through these diagnoses, okay? First of all, just to let you know, all of these diagnoses, most of these diagnoses that I'm gonna speak about today are in the DSM-5 and the DSM-5-TR. And in the DSM-5 or the DSM-5-TR, these diagnoses are under the feeding and eating disorders, so that category there. The diagnoses that are under that category that I'm going to talk about are pica, rumination disorder, ARFID or avoidant restrictive food intake disorder, anorexia, and I will subdivide anorexia for you, bulimia, binge eating disorder or BED, OSFED, which stands for otherwise specified feeding and eating disorder. And so specifically with OSFED, I will talk about atypical anorexia. And then the last one is USFED, which is unspecified feeding and eating disorder. On top of those diagnoses, I'm also going to talk about REDS, which is relative energy deficiency in sport, as well as orthorexia and diabulimia. So I'm going to be relatively brief on those three diagnoses, but I think those are important to consider. Again, they're not part of the DSM-5, but are definitely a piece of what I tend to see in my practice. The important thing to consider with these different diagnoses is that I don't diagnose the patient with one of these eating disorders. This comes from another provider in the mental health space. So it could be a psychologist, psychiatrist, that sort of thing. So just to clarify, as a physical therapist, I don't diagnose these. All right, let's start out. So pica is where an individual ingests or eats something that is not considered food, or doesn't have any nutritional quality. That might be a better way of phrasing that. You know, they might eat something like a cotton ball or ingest like a spoon or something like that. This diagnosis is interesting. So what happens for individuals with rumination disorder is that they will eat and then they will regurgitate their food, kind of an automatic response. Can be very, very uncomfortable, can cause issues with dentation, with teeth and that sort of thing. Lots of reflux, as you might imagine, so kind of that acidic kind of feeling in their esophagus, in their mouth, and that sort of thing. I've worked with individuals with rumination disorder a little bit more frequently in my private practice, and so that has been really interesting to kind of get to know that diagnosis a little bit better in terms of how we can help from a physical therapy standpoint. I think one of the best ways to kind of explain it, and then to explain it a little bit further, is that it's picky eating, but it's beyond that of a picky eater. So typically these individuals may be anxious or have a concern about having an aversive consequence to eating. So for example, they may have in the past had a choking episode when they were eating, and so they may relate that anytime they're eating. So it may be very, very difficult for them to obtain the nutrition that they need. Oftentimes ARFID can be one of those things that you can begin to identify in kiddos. So again, it's beyond that of being a picky eater. One thing to remember related to this diagnosis is that there isn't a concern, a fear, a worry about gaining weight. So there's no body image association with ARFID, and sometimes ARFID can exist with other diagnoses as well. So there could be body image issues at some point in time. Anorexia is probably the number one diagnosis that comes into your brain when we talk about eating disorders. I'm going to subdivide it into two different categories, but the first thing I want you to know about anorexia is that this is an individual that has an intense fear of gaining weight. And so oftentimes they will restrict nutrition. They may have some body dysmorphia in terms of when they see their reflection in the mirror, they may not get an accurate representation of what their reflection is. So for example, they may be in a very lean, slender, maybe perhaps a malnourished body, and that is not necessarily what they see in their reflection. So these are individuals that are typically clinically underweight. I'm not going to get into the classifications around that because that's a little bit more complex, but anorexia nervosa can be subdivided into two different subtypes. So there's ANR, which is anorexia nervosa restricting, and then ANBP, which is anorexia nervosa binge purge. Anorexia nervosa restricting is that pure restriction of nutrition and calories. An interesting part of anorexia is that if individuals experience overexercise or compulsive exercise, then that is a component of ANR. Anorexia nervosa binge purge are those individuals that will binge a certain amount of food. Again, a binge can be relative, and then they typically follow up with compensatory behaviors. So that can be something like taking laxatives, purging via vomiting, using diuretics, that sort of thing. Both of those result in clinically underweight. Bulimia is very similar to anorexia nervosa binge purge. They will binge one time a week for about 3 months, and that's how we kind of find that diagnosis. The difference for bulimia nervosa is that these individuals typically aren't clinically underweight. Binge eating disorder is, again, kind of similar to bulimia nervosa. What it results in is a binge episode where the individual kind of feels out of control, like they cannot stop the binge. And then typically what happens after that is they will follow by a period of restriction. And so then that period of restriction will again be followed by a binge cycle. So it kind of is this continuous cycle. The interesting thing that I found about the kind of understanding that like cyclical approach to that is that that is typically what happens when we participate in a diet. So just something I kind of think about. OSFED, which is otherwise specified feeding and eating disorder, and I mentioned atypical anorexia. So atypical anorexia is under that umbrella of OSFED. The really important thing to understand about atypical anorexia is that these individuals meet the criteria for anorexia nervosa, yet they are not clinically underweight. So this can be really confusing. Oftentimes there is kind of this thought or perception that having an eating disorder has a certain look. I know I mentioned it when I was talking about anorexia. Our typical view of an eating disorder is a severely malnourished person. And an individual that has atypical anorexia doesn't look that same way, but have all of the same medical issues. Eating disorders do not have a look. So eating disorders affect all body shapes, sizes, all body types, really all bodies. And the unfortunate thing is that oftentimes these individuals do not get the care that they need because they're kind of missed in terms of having an eating disorder. USFED, unspecified feeding and eating disorder, I'm really not going to say a whole lot about that. I kind of think of that as if we can't use one of the other diagnoses based on the categorization, then this individual may fall under USFED. Pretty important one to consider in terms of, oftentimes we find this in our athletes. So REDS is essentially low energy availability. It used to be called the female athlete triad several years back. I think it was probably in the 80s that it was called the female athlete triad. One of the criteria for having REDS was losing the menstrual cycle. Now that kind of suggests that the only individuals that can have REDS are those that menstruate. And we found that this does not adequately describe this diagnosis, because that really kind of rules out our individuals that are not menstruating, and everybody can have REDS. Recently, the International Olympic Committee in 2023 put out a consensus statement. There's an article that talks about REDS and kind of the new formulations of REDS, and it talks about different conceptual models. So it has a health conceptual model and a performance conceptual model, and it's really great because there are these two like circle diagrams that really talk about all the different areas that relative energy deficiency in sport are affected by having low energy availability. So I think that's really important to keep that on our radar as well. Orthorexia is another, I'm calling it a diagnosis, but I don't know if it's really a diagnosis per se, but it has been talked about. And orthorexia is typically where an individual is participating in more of what we might call clean eating or healthy eating. Will often not do certain things because if they are not able to eat the food that they feel is healthy and the right thing to put into their body, then they won't do those kind of social things. So really the world kind of revolves around that healthy, what is deemed healthy for their standards. Diabulimia is essentially where an individual has an eating disorder and diabetes, and so they may choose to skip using their insulin as a way of controlling their weight or perhaps manipulating their weight. And that's seen as a way of purging. That was kind of a lot to include in one video. Hopefully they make sense. So several different diagnoses, some in the DSM-5 and some not, but hopefully that's helpful to have that information. And feel free to reach out, ask questions. Happy to talk more about this. Thanks so much for watching.